Tennessee is one of the top 3 most impacted states when it comes to a lack of maternal care, which means a large number of our counties have little to no hospitals or birth centers. Offerings for expecting mothers or infants. Our Sydney Whitty has the latest on a new March of Dimes report.
In Tennessee, there are over 90,000 women impacted by maternal care deserts. That's according to the March of Dimes new report. The report shows that 32% of counties in the state are maternity care deserts, many being rural areas. To name a few, that includes White, Cannon, and Trousdale counties. March of Dimes says that maternal health care deserts are more often than not rural and median household income areas that are impacted the most. This means women in those areas travel 2.1 times longer than those in full access counties like Davidson County. And about 58% of counties have no birthing facility. The state has made postpartum extensions to help mothers, but March of Dimes notes that the state could do more to support midwives to help with relief. Now, across the entire United States, nearly 6 million women are impacted by maternal care deserts. In Nashville, Sydney Whitty, WSMB4.